Welcome to Divabetic's World Menopause Day program, featuring a panel discussion on menopause and diabetes. Menopause is not discussed enough, in my opinion, and it's not a punchline. It's not a joke. You always hear women undergoing this change of life, and people like talking about it in this almost funny kind of offhanded way about hot flashes, and I mean, it's an essential to a culture that we learn to understand and to honor menopause and not make fun of it. And it's not something that should be in the dark shadows. We should bring this forward, like diabetes has been in the dark shadows, and everyone is quote unquote ashamed of it. Dr. Arena, why don't you tell us a little bit about your journey? I'm so fascinated by what you've gone through to get to where you are right now. It's truly a remarkable universe telling you what to do.
Thank you. Thank you so much for having me on this panel. So yeah, my ride, I definitely went the initial traditional medical model approach and was a traditional OBGYN and loved what I did, loved taking care of women in all phases of their life, delivering babies and doing surgery and all of that. There was definitely a paucity of education around women care and menopausal care in my training and traditional training. It was really all about pregnancy, having the baby, doing the surgeries, not really taking care of women, after that, and then through menopause. So you sort of leave training without that experience and kind of get it along the way. So I was out there practicing, sort of learning as you go. Okay. Aging with my patients as well, going through perimenopause. And I would say probably my aha moment was probably about 6 or 7 years ago, where I went to a conference on integrative medicine in women's health. What the heck is that, right? Integrative medicine means we're looking at a multimodality approach to taking care of women, right? We're traditionally trained. What are your symptoms? Here's your diagnosis. Here's your pill for your ill.
Oh, yeah.
So that's just how we're trained. And this conference opened up my eyes to there's so many more tools in the toolbox to help our bodies, to help my patients, to help my sisters, to help my mother as I was going through this, and how all of our body systems talk to each other. Again, we're sort of trained traditionally in silos. You see your primary care, you see your endocrinologist, you see your gastroenterologist, you see your cardiologist. Nobody, oftentimes they're not talking to each other, but our whole body systems are talking to each other.
Oh.
So in that aha moment, I said, okay, I need more tools in the toolbox. And I went back and I got further education in sort of a more integrative and what's called functional medicine approach, getting to root cause. And in this whole trajectory too, as I was aging and dealing with patients more and more, I felt like there was such a lack of conversation about aging and perimenopause and menopause and hormones. And so I really took a deeper dive into that and created a practice where I could really spend more time with women talking about that. In the traditional medical model, you're tasked with appointments, double booked every 15 minutes, seeing 30 plus people a day, and you don't really get the opportunity to have those conversations. So I took a big leap out of that traditional model and created a practice where I can spend more time with women. I do have to honor traditional medicine. It saves lives. So I consider myself the bridge between the two, and opening up the conversation and being able to have deeper conversations about lifestyle, about nutrition, about sleep, and certainly about hormones. And as they're shifting and changing, I would have patients come to me and say, I asked my doctor, is something going on with my hormones? No, that's just normal. Or have testing done and be told, oh, it's in normal range, or we don't know how to test your hormones. So much frustration. So that's really how I've created the current practice that I'm in now with, I still see women in their teens up through post-menopause. My passion and my jam is balancing their hormones all throughout that journey, but definitely
Wow.
perimenopause and menopause.
That is awesome. How, how can we see hormonal changes as kind of a gain rather than a loss? Or how do they all work as this tapestry in your body?
Sure. I often use this analogy, and you may have heard this term of what I call the hormone symphony, if you haven't heard that term before. So if you picture a symphony up on stage, right, you have the wind, the string, the percussion, they're all playing beautiful music together. Well, if our hormones are up on stage, yes, it's estrogen and progesterone and testosterone, but it's also glucose and insulin on that stage, right? So we have to talk about gut and nutrition. On that stage is our thyroid gland in our neck. And on that stage is cortisol, our stress hormone, our fight or flight hormone, right? So cortisol is such a big driver in that hormone symphony because as women, we are tasked, right? We are multitaskers. We are super women. We have 50,000 balls in the air. Our cortisol or our fight or flight hormone is running, 24/7. Okay. So now picture someone in the symphony who's playing really loud and really fast. Okay. Everyone's trying to compensate. We're trying to do our thing. Well, what's going on with our glucose and our insulin? What's happening in perimenopause and menopause as other hormones are starting to shift and change? So I tell people it really can be a garage band and not necessarily a hormone symphony. We really need to look at all of those players. We're good at Band-Aids. Oh, here's your thyroid medication, or, diabetes. Here's your diabetes medication. Well, what's going on with the other players and how they all intertwine with each other?
That's the integrative approach, right?
Yes.
That's the 360 where everything affects everything else. And I absolutely adore that. How do your patients feel about going through menopause? Are they afraid, or you're telling them this is what's going to happen? I noticed you said that, you're going to, you get them from teens to middle age. I mean, that's ideal. I mean, that is an ideal scenario. So how
The
do you
earlier
deal
that
with?
we can, right, the earlier that we can educate
Yes,
about what's happening with our bodies and what to expect, then there's not as much fear around it, right?
yes,
So, right, a typical perimenopausal or menopausal one will come in with a host of complaints. And I've definitely learned to say no symptom that someone has is not necessarily related to menopause. It's not just a hot flash and a night sweat or vaginal dryness. It could be mood issues, sleep disturbance, changes in weight. It's endless, right?
yeah,
Rashes, skin changes. Again, so much is happening that I've learned to say, okay, could that be perimenopause or menopause? Absolutely.
yeah.
So starting off that conversation, what's going on with them? What are their symptoms? And again, the timeline of it. And the other thing that's really important is what other things are happening in your life at this time? What other stressors? Because we can have a hot flash or a night sweat, but it doesn't always mean that it's our estrogen. It could be our cortisol. It could be other things. So really getting a whole picture of what's going on. Are you sleeping? Are you not sleeping? Right? All of these sorts of things.
Right.
What's your alcohol intake? Because alcohol disturbs our sleep, makes us have hot flashes, all those sorts of things. So I really try to get a whole picture. I ask a lot of questions.
Divabetic. It's all about attitude.